The objectives of this video are to demonstrate the components of the PFIT and how to apply the scoring algorithm for use in clinical practice and research. There are 4 components of the PFIT. The first component is shoulder flexion strength. The second component is knee extension strength. The third component is the level of assistance required for sit to stand. Finally, we measure marching cadence. To perform the PFIT, you will need a bed, a chair, and a stopwatch or a clock. The strength components of the PFIT are scored on a grading system from 0 to 5. Always begin testing at the grade 3 level. At this level, the patient should be able to complete the available test range of motion against gravity, but tolerate no additional resistance. To test for grades 4 and 5, we use the same testing position, but add resistance onto the movement. At the grade 2 level, the patient should be able to complete the full or partial range of motion with gravity eliminated. Grades 1 and 0 both have no movement, but in grade 1, there is evidence of a contraction. The strength components of the PFIT are converted from the 0 to 5 grading system to the 0 to 3 scoring system. Grades 0, 1, and 2 are scored as 0 on the PFIT. Grades 3, 4, and 5 are scored as 1, 2, and 3 respectively on the PFIT. This test can be done either sitting upright in bed or sitting upright in a chair. For the purposes of this video, we will show you sitting upright in a chair. Please ask the patient to lift their arm up to shoulder level. If they are able to do this, they are said to have grade 3 strength, and we can now apply resistance. The hand applying resistance should be contoured around the patient's arm just above the elbow. The other hand should stabilize the shoulder above the shoulder joint. The examiner then says, "Hold it, do not let me push your arm down," and applies resistance. If the patient were unable to get their arm up to shoulder level due to weakness, but were able to get some movement, they are said to have grade 2 strength. If the patient were unable to get any amount of movement, palpate the anterior deltoid for a contraction and ask the patient to bring their arm up. If they are able to get a contraction, they are given a score of 1, and if not, they're given a score of 0. Please lift your arm in front of you to shoulder level. Though it is possible to test the patient for knee extension strength both in sitting and in supine, it is important to note that if the patient does not have grade 3 strength, we must test them in supine. This will be shown according to the Asia principles and will be shown later on in the video. When testing the patient in the sitting position, we simply ask the patient to straighten their knee. If they're able to straighten their knee, they are given a grade of 3. If they are unable to straighten their knee to 0 degrees, we must test them in supine to test them for grade 2 strength. When applying resistance, the patient starts in an upright sitting posture with their knee fully extended to 0 degrees, avoiding hyperextension. The hand applying resistance is on top of the leg just proximal to the ankle. The other hand is placed underneath the thigh above the knee. The examiner then asks the patient to hold it, "Don't let me bend your knee," and grades accordingly. Okay, Erin, can you please straighten your knee? Good. And I'm just going to put some resistance on here, and I want you to hold it. Don't let me move you. Good. When testing in supine, the patient's hip should start in neutral rotation, neutral abduction, adduction, and 15 degrees of flexion. The examiner should put their arm under the tested knee and rest the hand on the patient's distal thigh of the leg that's not being tested. This causes the tested knee to flex to approximately 30 degrees. The examiner then asks the patient to straighten their knee. If the patient is able to straighten their knee through the full range of motion into extension, they are said to have at least grade 3 strength, and we can now apply resistance. Resistance is applied with the patient's knee in 15 degrees of flexion with the same examiner positioning as before, but the hand applying resistance is placed just proximal to the ankle. Ask the patient to hold this position, "Don't let me bend your knee." The examiner then exerts a downward force into knee flexion while the patient attempts to hold the knee in 15 degrees of flexion. If the patient does not have grade 3 strength, we need to assess them in an anti-gravity position. To assess knee extension in an anti-gravity position, the patient's hip will be in external rotation and 45 degrees of flexion, and the knee will be flexed to 90 degrees. Support the distal thigh and leg as you ask the patient to straighten their knee. If they are able to do this movement now, they are said to have grade 2 strength. If not, we should now test to determine if they have a muscle contraction or not. To distinguish between grades 1 and 0, place the patient with their hip in neutral rotation, neutral adduction, abduction, with both the hip and the knee in 15 degrees of flexion. Support the leg while either palpating the quadriceps muscle belly or the patellar tendon. Ask the patient to either straighten their knee or push the back of their knee into the bed. Please straighten your knee. Some tips to remember. This test is a static test with resistance only being applied in the testing position. The stronger leg or shoulder should count as the score for the PFIT. If the patient is in the gravity eliminated position, the maximum grade that they can get is a 2. To assess the level of assistance that a patient will require from sit to stand, we simply ask them to stand up and ensure that we have close supervision to allow them to have as much assistance as they require. Scoring this measure is again from 0 to 3, but it is scored based on the level of physical assistance that the patient needs to complete the task. If the patient is unable to stand from a sitting position, they will receive a score of 0. If the patient requires 2 people to stand from sitting, they will receive a score of 1. If the patient only requires 1 person to stand from sitting, they will receive a score of 2. If the patient can stand from a sitting position independently, they will receive a score of 3. Only the level of physical assistance needed by the patient is incorporated into the grades. Therefore, the patient may achieve a maximum score even if the examiner is required for close supervision. Can you please stand up? We'll help you out as much as you need. Okay, can you please stand up? Good. Can you please stand up? Good. Okay, can you please stand up? Good. Begin this test in standing. The patient is allowed to use a walking frame if needed for support once they're in standing. We need to explain to the patient that this is a test of their maximum exercise capacity. So we need to tell them that we are going to be recording how many steps they take and how long they are marching for. Give the patient standardized encouragement every 10 seconds. This can be, "You're doing well, keep going for as long as you can, and well done." Each time the patient takes 1 step with 1 foot, this counts as a step. It should be noted that the entire foot should clear the floor. If they stop taking a step for more than 2 seconds, then the test should stop. Alright, so now that you're standing, we want you to march on the spot. So we'll be recording how many steps you take and how long you were able to march for. So it's a test of your maximum exercise capacity, so we want you to march for as long as you can. Okay, so whenever you're ready, you can start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Keep going, you're doing well. Make sure you watch for entire foot clearance. As seen here, the patient is clearing the floor. We see here that in some instances, the patient does not completely clear the floor with their right foot. 103, 104, and stop. Okay, so we've made it to 3 minutes, so we can stop the test now. Good job. This is scored from 0 to 3 with faster marching cadences associated with higher scores. However, if the patient is able to march on the spot for 3 minutes, they will achieve a maximum score of 3 regardless of their marching cadence. We can calculate the patient's cadence as follows. If the patient takes 75 steps in 1 minute and 20 seconds, we would equate that to 75 steps in 80 seconds. We then divide 75 steps by 80 seconds. Because this now only gives us the steps per second, we must now multiply by 60 because there are 60 seconds in a minute. This patient would then get a final score of 56 steps per minute. The patient would therefore be given a score of 2 on the PFIT. To summarize, all 4 components of the PFIT are scored from 0 to 3. The strength tests are graded the same way as the manual muscle test, with scores from 0 to 5, with 5 being the max score. Grades 0 to 2 are given a score of 0 on the PFIT, and grades 3, 4, and 5 are given scores of 1, 2, and 3 respectively. The sit-to-stand is scored based on the level of physical assistance that the patient needs to complete the task, with higher scores associated with increased levels of independence. The marching cadence component is scored from 0 to 3, with faster marching cadence associated with higher scores. As mentioned earlier, if the patient can march on the spot for 3 minutes, they automatically receive a score of 3. In the PFIT-s, the 0 to 12 ordinal scale is converted to a 0 to 10 interval scale. This is shown to allow more precise and sensitive measures of change. To conclude, the PFIT is a reliable and valid outcome measure for the use in critically ill patients. This video demonstrated the individual components of the PFIT so that clinicians may have a consistent way of implementing it in practice.